Wonderful. So we'll begin as everyone starts to do that. This is a very exciting webinar. It's part of the series that we have so kindly sponsored by the Numinous company. And I'll share a little bit more about Numinous if you guys have not heard about this incredible company in Canada, an organization. But first and foremost, I'll introduce myself, and then I'll introduce Dr. Evan, who's with us, and we'll get right into it. So first and foremost, my name is Salimeh, and I'm one of the founding members of the Canadian Psychedelic Association, now rebranded to the Psychedelic Association of Canada. And our mandate and the reason why I exist is to awaken a revolution of well-being at these very interesting times that we're all living in. There has been a resurgence of the psychedelic movement and healing, and it's very different than what some of you who were there during the 60s and 70s experienced. And now we have so many different modalities and understanding of trauma-informed care, as well as the resurgence of research coming in. And so at the Psychedelic Association of Canada, we really thought that it was important to educate and advocate access to all psychedelics as a basic human right, as incredible tools and methods of healing and self-transformation. So our overall vision is people living in harmony with each other and nature, and our values are love, courage, communication, integrity, impact, and sustainability. And it's my incredible privilege and honor to introduce our guest today. Please help me welcome Dr. Evan Cole-Lewis, who is a distinguished member of the Numinous team. And Dr. Lewis is a renowned neurologist and clinical neurophysiologist specializing in pediatric neurology and epilepsy. He's the VP of Psychedelic Neurology Clinical Services at Numinous, and he's also founder of their Toronto clinic. His research and special interest includes psychedelic neurology, cannabinoids in the treatment of epilepsy, and other neurological conditions. He actively contributes to research and clinical trials while advocating for virtual medicine to improve access to neurological care within underserved areas of Ontario. Now, this is, doesn't do it justice in what Evan really has done, and what he's working on really at the frontiers of medicine. And we haven't ever covered really the specialization of neurology and the intersectionality of that with psychedelics. And that's why I'm personally very excited, and I'm sure many of you are as well. A little bit about our kind sponsor tonight for these specialized series. Numinous, a mental health care company advancing innovative treatments and safe evidence-based psychedelic-assisted therapies, helps people to heal and be well through the development and delivery of innovative mental health care and access to safe evidence-based psychedelic-assisted therapies. With a commitment to innovation and cutting-edge research, Numinous is revolutionizing the field of psychedelic-assisted therapy and integrative mental health treatments. The groundbreaking work has already achieved remarkable milestones. And this is very true if you've been watching the news in Canada. And this includes the successful completion of numerous clinical trials, the establishment of a state-of-the-art research and development facility, and most importantly, the announcement of their partnership with MAPS to support therapist psychedelic experiential training. And this is, of course, a very kind thank you to Peyton as one of the co-founding members of Numinous, and of course, a broader thank you to their team for their exceptional care in the field. So, Evan, I'm going to pass it over to you. And I love asking the origin story and the inception story of how people got involved with psychedelics. So love to hear what brought you into the field. And I know, the foundational part of your work, of course, is with children, epilepsy, and cannabis. And then you have gone into specialization in other areas as well. So please share a little bit more about your start.
Great. Yeah, thanks, Salimeh. It's really fantastic and an honor to be here. I love talking about psychedelics in general, and I know we've got some interesting things to cover today as well, which we're going to chat about, and excited to share that with everybody here who's made the time to come today, as well tonight, maybe today, depending where you are. It looks like there's quite a few people from different places in the world. So it's a pleasure and honor to be here to provide more information about such a fascinating, interesting aspect of psychedelics, which is the field of neurology. But yeah, to answer the question, so it was the origin, I would say it's hard to pinpoint exactly maybe where, but I think really it started in my early residency training when I became intrigued and quite interested in cannabis for pediatric epilepsy. I was moving towards pediatric epilepsy as a core kind of component of my training and of my neurology work, planning on going into specialization in epilepsy and epilepsy surgery. And it was hard, if you had your eyes open, to miss the parents coming in, the patients coming in, and kind of a little bit of murmuring in the public sphere and the media about cannabis for epilepsy. Yet it was really kind of a faux pas. It wasn't discussed formally at all in our education. And that intrigued me. And really that's where it was. So to a very long story short, in that sense, I began to explore that, started to work with patients, despite a lot of limitations in the formal field of medicine, working with them with cannabis. And ultimately, when I was at Sick Kids, there wasn't really a lot of Sick Kids Hospital in Toronto, where I was finishing my training and worked there for first early part of my career. It wasn't well supported, so I decided to leave Sick Kids really to focus on cannabis and pediatric epilepsy, and opened up a clinic in the community of Toronto, in the public system, primarily to serve these families and these patients. And I think that's probably, if I had to really pinpoint a time in which there was a fork in my career, it was probably then, because I had the kind of freedom to explore more of what was of interest to me, and to not worry so much about regulations within the hospital, or kind of certain levels of degrees of tasks or goals or objectives laid down by the hospital. I could really kind of explore this on my own. And in doing that, it really developed me as a doctor, developed me as an individual, to work on the fringes of an area where people were not exploring, or were hesitant to explore. And in doing so, that really, it was hard to miss the psychedelic literature and the same kind of mumblings or, coming out from the public and from patients about psychedelics. And this kind of all coincided in about the early 2010s, leading into early, around 2016, where I was working with cannabis, and then started to really explore psychedelics. And in my work, I started to think, where within the field of neurology would psychedelics apply? And it occurred to me, being in the cannabis space and seeing a lot of the indications for cannabis coming from patients and parents, and putting specialists in a really difficult position, knowing their specialty well, but not knowing about cannabis, I thought this is going to happen with psychedelics. You're going to have a bunch of specialists who are going to have this really complicated, medicine, being psychedelics, thrust upon them without any knowledge about it. So I started to think, we have to really take this from a specialist-centric view and look in our specialties, for me being neurology, where do psychedelics apply? And then combining, the rich foundation of knowledge we as neurologists are privileged to learn through our education system, and then through practice, and figuring out where exactly in that paradigm psychedelics fit. And honestly, since then it's been so amazing. I mean, there's so many areas of neurology where it's very obvious psychedelics have the potential to play a major role. But then the important piece of that, on the other side of the coin, is there's clearly areas of neurology where psychedelics should not play a role, and they're probably not indicated. But it takes the knowledge of a specialist to really understand that, and to parse that out. And it's exploring both sides of that coin, which it makes my job on a day-to-day now so wonderfully fascinating. There's something new to learn every single day, given that this is such a brand new field, and it's really wide open for discoveries and for insights.
Wonderful. Appreciate that. And, I have so much respect for you, because it was, 2010, still not really in the mainstream at all. And cannabis research is still, we're at the tip of that iceberg, of what's possible with this medicine. And so for you to take that stance and step outside and really come into the community and support the community without the red tape and the regulations, like you said, of the hospital, it takes courage. And so, I just want to honor you for that. And also now this next step of neurology, and how some areas of psychedelics can fit and some areas maybe do not necessarily need to go hand in hand. But I want to bring it to the present time. And I know this specifically, this conversation is in your specialty of functional seizures. So tell me, maybe we can start exploring there a little bit. Tell me a little bit about functional seizures and how they're different between epileptic seizures, which was the foundation of your work prior.
Yeah, sure. So that question in and of itself, we could sit here and talk about this for an hour and a half and debate the subtleties and really try to explain this to people. And it's a challenging thing. So I'm going to try to do this to the best of my ability. And please, everybody, if there's holes in kind of these metaphors or how I'm explaining this, then feel free to leave in the chat and we can further explain this. But just to backstep, take a few steps back. In order to really understand functional seizures, the best people to do it are those that have a really good foundation in epileptic seizures. And so I think that was where my personal interest in functional seizures arose from, is that my core training is in epilepsy in children and in adults. And so intermixed in that is this concept of functional seizures, which I'll explain. So I think that's where I really, as part of the ongoing origin story, into the present day, why I have this real fascination and interest in functional seizures and looking for ways to help people who suffer from them. So what's the difference? Okay, at the basic level, the word seizure is confusing because they're both seizures. So I think it's best to kind of explain what epileptic seizures are, and that might help understand what functional seizures are. So epileptic seizures are an electrical phenomenon. Our brain is run on electricity at the cellular level, and that electricity is very well coordinated in the brain. In order for us to do all the things we do, perceive the world we are, move in the way we move, and it's very finely tuned and regulated. And if that becomes dysregulated, then what can happen is you can have uncontrolled electricity in the brain. And if you have uncontrolled electricity in the brain, that is what a seizure is at a very kind of high level. And we see this, depending on where in the brain the uncontrolled electricity occurs, the person will exhibit that behavior. So for instance, if you have a whole brain seizure, so that there's complete electrical dysregulation in the brain, these are the larger seizures that we see, the larger epileptic seizures that we see. You can have seizures where people just stare off. And that has to do when there's dysregulated electricity in very critical circuits that control consciousness. You can see seizures that are just a hand opening and closing. So that means there's dysregulated electrical activity in the area that subserves the right hand. And it can stay there. So a seizure can present itself in any way. But because they're electrical seizures and they're confined to certain areas in the brain, a trained neurologist can look at these electrical seizures and know that they are electrical seizures, which is another way to say that would be epileptic seizures. So epileptic seizures are electrical seizures. That's one way to kind of think about it. So there's this other types of seizures, and these other types of seizures are functional seizures. And functional seizures refer to there being a dysfunction in how the brain is operating. So another way to think about it is a non-electrical seizure. The electricity is actually coordinated okay, but the dysfunction is at a different level. It's in how the brain is just communicating as a whole. So when someone's having a functional seizure and I put an EEG on their head to record the activity, it's actually normal. The electrical activity appears normal in these individuals. So we know the origin of this is not dysregulated electrical activity. So the origin is actually its dysregulated function. And then one way to think about this, and this is put forward by a model that's put forward by Dr. John Stone, who's a neurologist, and he actually has done a lot of work in functional neurological disorders. So functional neurological disorder is a whole host of disorders that are due to dysfunction in the nervous system, and functional seizures is one type of these disorders. And so he's kind of put forward a model of software and hardware, that we can test the hardware, and the hardware can all be intact, the hardware of the nervous system. But our hardware of our nervous system also has software, it has programs that it runs all the time. Coming back to the opening and closing of the right hand, like that's a program in my brain, right? I'll ask, I often say this to people, and I say, okay, like open and close your right hand. How are you doing that? Right? And a real, even like maybe a neurology resident might say, well, I'll tell you exactly where. In the hand area, in the motor cortex, it's sending out signals that go through the internal capsule into the brain, and they'll give me this entire pathway into the right hand, into all the way into the muscles of the right hand. But that's just the hardware they're talking about. But if the hardware can be intact and you can still have problems in your hand, you could have a software problem. So again, if I say, how are you moving your hand? You don't know how you're doing it. You just do it. You just put your hand up and it moves. You say, I will it to do it, I do it, but it's like, how are you doing it? You don't really know. That's just this embedded program. That's the software. And so there's software that keeps our whole system regulated and functioning properly. So that software can be disrupted by certain processes in the brain. And when that software gets disrupted, the things that regulate our entire body can become dysregulated. So we can get shaking, for instance, right? That's not due to Parkinson's disease or something else. And that shaking can just due to the way the software in our brain is being run. So this is one way that functional seizures can be described. It's a problem in the underlying software that runs the nervous system. And that becomes dysregulated. So we don't really have any tests that analyze our software. So it's really difficult to find a test that tells us that someone has functional seizures. But the way to diagnose that is if we, by the way they appear for a specialist like myself, we can look at these and because they're not coming from one part of the brain from an electrical phenomenon, they have an appearance that is not like an epileptic seizure, and we kind of know that a little bit. But sometimes they can look very similar to an electrical seizure. So the other way to do that is to put an EEG on somebody and try to capture one of these seizures, i.e. they have one of the seizures while on EEG. And when there's no electrical activity, we then know that this is a functional seizure, and the problem is in the origin of the software that's running our brains and our behavior.
Beautiful. It's I think this is probably one of the hardest areas to explain in a way that's, really well defined and understood. And I appreciate the differences that you examined and placed right now. So let's go a little bit further, and I want to link it back to psychedelics, because you and your team recently had a study that was published in Frontiers in Neuroscience, and I want to touch upon that. But if you're saying that with functional seizures, it's an underlying software issue of the nervous system, it's not an electric phenomena. And so then where do you see, again, the support of psychedelics with functional seizures, as opposed to maybe cannabis and epileptic seizures?
Perfect. Yeah. And that's a really good distinction right there, Salimeh, that you said. And the one thing I'll just also note in terms of the functional seizures, just to add one more layer, which is really important. There's a lot of thinking out there that functional seizures, that people have control of them. People have them, they have control, and they're putting them on, or they're like a panic attack or something, and they're not. It's really important for everyone to understand, just like epileptic seizures or electrical seizures, these non-electrical functional seizures, people do not have full control of these as well. They just happen out of the blue, and they're driven subconsciously. So that's a really important piece to say. Coming back to, cannabis and psychedelics versus one or the other. So cannabis, the way medical cannabis works is it does finely tune the electrical activity of the brain. And that's why cannabis works for epileptic seizures. And cannabis is not a treatment for functional seizures, because functional seizures are non-electric, and cannabis doesn't act to kind of shift the software of the brain. But that's the key there. Psychedelics can shift how the software programs in our brain are deployed. So taking back a step, then you have to say, okay, well, what in the brain represents the software programs? And our brain is a bunch of cells, right? So it actually has over 100 billion cells. So as many stars as there are in the Milky Way galaxy, we have those number of cells in our brain. Okay. And I think if you take like the long axons of the cells, so nerve cells have a long kind of body to them, neurons. And I think if you attach them end to end, they would go around the Earth like 3 times. Right? So we have a lot of cableage, a lot of cells in this box right here. And the connections between them are numerous. They can have anywhere from 10 to 1,000 connections. Do the math on that. And it's just trillions of connections in our brain. So when we look at those connections in the brain, there's actually regions that all kind of do a similar thing. And then those regions connect to other regions that connect to other regions, and our brain actually forms networks. There's actually networks where there's areas in the brain here and here and here that connect, and that can form one network. And then there's another network that connects different regions of our brain. So in order for us to perceive the world, perceive ourselves, our brain is actually networked in very specific ways. And one could say that those networks and what they do individually and how those networks interact with each other, they provide the software programs that allow us to perceive the visual world, to know where your body is in space, to have an idea of you, for instance, Salimeh, that you are the Salimeh of yesterday, who's reached the Salimeh of today. And after we're done our little chat here, you're gonna maybe go for a nice hike in the jungle of Costa Rica, right? So all of that, for you to have that continuous timeline and know that it's so complex. If everybody in the audience just thinks a little bit about, that seems really easy that, okay, yeah, of course, but think about all the details that are required for you to have some idea that you existed 5 minutes ago, exist now, and exist again in 5 minutes. Like there's a lot of stuff that's required for that concept to take place. So these are all the networks, these are all the software programs that are being deployed. So what we know with psychedelics is that psychedelics tend to take these networks and kind of relax them and allow them to be more interconnected and less separate, right? And it also allows us to take these to shift from one state the network might be into another state the network might be. So at one point you can be very focused, like everybody might be focused on me and the words I'm saying, and that is one state. But you close your eyes and start thinking about yourself. In order to switch into that state, that requires a shift from networks to another networks. And these are just software programs. It's like when you load up Zoom to watch this, and then you've got to, load up a notepad to type at the same time. Then you're going to copy and paste an image from one to the other. These are interacting software programs. Your brain is doing the exact same thing. And what psychedelics do is they permit a more dynamic interaction between networks. So one might then say, okay, well, why would this work in functional seizures? Well, the idea is with functional seizures, you've got a program that's running that's not serving you. It's the brain is executing a program that's telling you to have these seizures for various different reasons. We can chat about that afterwards. And it's become not helpful. So what psychedelics can do is can kind of relax or loosen the software program such that it can be re-edited, and you can then kind of reprogram the software in one way with some supportive therapeutic help in order to perhaps prevent the seizures from continuing to occur. So this is why the functional seizures are quite complex. So to summarize all of that for everybody, right? Functional seizures are a problem at the level of brain network interactions. Psychedelics act at the level of brain networks. And sometimes I simplify it so much to say psychedelics are brain network medicine. So all the brain network disorders, functional seizures being one of them, are potentially amenable to psychedelics. Complicated stuff. So hopefully this is landing for people, but it is challenging. And if you're, I mean, I know Salimeh, this is challenging because we've talked about it, and also people who are listening, believe me, this is challenging within the medical community. There's most people, most doctors who've trained for a long time don't understand this. And our understanding this continues to emerge. And that's why I even don't have we even don't have the language yet to really explain what this is. Like, that's how complicated this entity in this disorder is.
That's right. Amazing. But I really appreciate the metaphors that you brought in and how it is really a network. And then when we go into the software space of different softwares being activated and being brought up, and how psychedelics, we know that, the default system and just how much of the brain lights up on fMRI imaging to show there's so much more brain activity. And so as you're saying, psychedelics not only bring more interconnectedness, but also a relaxation so that neuroplasticity can happen. And so from there, I want to hear a little bit about your own research and how, let's keep going, of how maybe even a broad stroke of what other researchers are doing right now with different substances. And, your specialty, as you've shared with me, is of course headaches and seizures, but then there's, brain injuries. Yeah, we won't even get into the neural functional other issues, but just even brain injury itself and what Dr. Nolan is doing from Stanford and the research with ibogaine, which I find to be really fascinating. But yeah, tell us a little bit about the research that you guys are doing at Numinous and what part of it really excites you.
For sure, yeah. So I'll kind of speak to that first, and then I can kind of give a general overview of some of the other research that I'm aware of that's out there in the field of neurology and neuroscience. So coming back to this, so functional seizures is one representation of this umbrella term called functional neurological disorder, which in the past has been referred to as hysteria, conversion disorder. There's a whole host of things, psychosomatic disorders. These are the functional neurological disorders, where functional seizures are one subtype. So my interest, as we kind of alluded to, is that. And the work that we're doing in that is so nascent and so new. There's probably a few centers that have conceived of, and a few individuals out in the space. And I know there's some because there's a few papers published on this about psychedelics for functional neurological disorder. There isn't anybody I know that's really considered this for functional seizures, and I'm starting to talk about this with other neurologists and neuroscientists. But there is some thinking that it would work for functional neurological disorder. So that's emerging. Where are we? We are so new. We're at the theoretical level of this stuff. So the paper, and thank you for mentioning it, Salimeh, that we produced was actually a case report of an individual that we treated for functional seizure at my clinic, who had a really quite a remarkable response. This person was previously having several seizures a day for a very extended long period of time. And the thing with functional seizures is the misunderstanding out in the community and the misdiagnosis leads to a lot of mistreatment. And I don't mean mistreatment as in, not being nice to people. That does sometimes happen, though. A lot of people with functional seizures feel mistreated because they feel misunderstood, but more about wrong medications and giving the wrong medication. So a lot of these individuals end up with substance misuse problems with things like benzodiazepines. They end up with being treated with anti-epileptic medication, electrical seizure medication. These aren't electrical seizures, it doesn't work. So they suffer the side effects of these medications for no reason. It's a real difficult state of affairs. So this individual was dealing with a host of those problems. And after 3 sessions of ketamine-assisted therapy, had quite a significant response with a significant reduction in seizures and a significant improvement in depression scores and her ability to do and perform functions of daily living, taking care of the family and going back to work. Excuse me. And several months later now, it's still a challenge. It's still difficult, but in a far better place than where this person was before. So a real robust response, and we've never really seen this in functional seizures before. So quite an amazing thing. So the theory of this being a problem at the brain networks and psychedelics working to, be able to have that ability to reprogram the brain networks with good therapy seems to, we're putting that forward in this paper. And we're also describing certain candidate areas of the brain that could be responsible, that are involved with this from past research. So the next step there for us to look at is to really consider strongly what this is and what's happening at a mechanistic level. So it's my team and the team at Numinous and some other external researchers, we have got together and we've got a really fascinating mechanism paper that we're working on right now. And we hope to get that out soon about the mechanism. And then once the mechanism is laid down and we can look again, probably our next step would be to look at some imaging that's out there for because there has been studies where people with functional seizures have had MRIs and other functional MRIs and EEGs and other types of imaging, collecting all that data and seeing if it fits the mechanism we're proposing. Once we get there, the next step is to really take this to clinical trial. So we're looking, down the road in about 5 years, hopefully-ish, we'll see, to really have the opportunity to test this idea that psychedelics can treat functional seizures in a clinical setting. That would be fantastic. And if this is borne out to be something that's helpful, there would finally be a treatment, a medical-based treatment with a psychotherapeutic frame that could help these people, because there is some evidence of certain types of psychotherapy, a psychotherapy model really put forward by Dr. Kurt LaFrance in Boston, who's worked with functional seizure patients for a long time. And there's a therapy model. So if we can combine that evidence-based therapy model with psychedelics, that might really be something that would advance this field forward. So that's kind of my real strong interest. The last thing I'll kind of say this quickly is, what's really cool about neurology and psychedelics is if you have an ear to the space, you start to hear about these things, weird, strange things. So about a couple of years ago, I started to hear this story with people with spinal cord injuries were having these weird, very strange, consistent side effects to very low doses of psychedelics. And it was consistent amongst independent people with spinal cord injury. You could go online and kind of Google this on Reddit and you would read these accounts that these people were describing, and they were nothing like anybody else suffers from when they take psychedelics. So people with spinal cord injury were describing these extremely intense muscle spasms that they were getting in their limbs after consuming psychedelics. And if they had a lower spinal cord injury, for instance, their legs were only affected, they were just getting the spasms in their legs. Their arms were spared. So it was something about the area that were paralyzed or were paretic from the spinal cord injury, that they were having this abnormal, very significant response to psychedelics and creating this host of very uncomfortable side effects. Also very, high temperature and sweatiness. And I was looking at this and I was thinking, well, this sounds a lot like a condition called serotonin syndrome. So myself and two other researchers independently all came up with this idea on our own. I kind of posited a mechanism for it, and we got together and we just received acceptance for a publication for our paper, putting forward this mechanism of why this is the case. So here's another, area that I've kind of gravitated towards very interestingly is, using psychedelics in very special circumstances in neurological diagnoses. Something like this, we have to figure this out, and we've got to help people who have spinal cord injury who might want to go forward and use psychedelics in a safe manner. And so we got to figure out what's going on for these people and how can we assist. So that's another kind of roadmap down the road of ultimately working with this population to help. So those are my two areas of big interest. They're the areas where I want to kind of take the Numinous clinic in Toronto forward and really focus on, and that's hopefully going to be some clinical work down the road for me. So stay tuned, everybody. I'm excited to share that with you. And then kind of to just take that final left turn into, okay, what are the other areas for psychedelics in neurology? Well, coming back to the idea of psychedelics being brain network medicine, we just have to conceive of what are the brain network disorders, what are the very strong big brain network disorders. So you mentioned Dr. Nolan Williams and his work with traumatic brain injury, and we see a lot of concussion patients at my clinic as well, and long-term concussion patients. That's a brain network disorder. When you get a concussion is defined actually by when we do an MRI and we look at the brain, no hardware problem. The brain is totally normal. And this is really confusing for people with concussion because they have very significant symptoms They have symptoms that are like whole brain symptoms. They have cognitive symptoms, sleep symptoms, pain and physical symptoms. They have emotional and behavioral symptoms. So you're talking about the whole brain. But you take a picture of the brain and it's normal. I put an EEG on those brains and the electrical activity is all normal. Hardware is intact. What's the problem with concussions? Software problem. Where did the software come from? Brain networks, right? What does psychedelics do? Brain network medicine. This is why we're emerging into this space where TBI seems to be amenable to psychedelics. And Dr. Nolan Williams, as you mentioned, he's exploring that. Dan Carcillo, he's been very prominent. He's a hockey player who had a really dramatic shift and turn from his long-term concussion symptoms due to psychedelics. Aaron Rodgers, who was at Psychedelic Science just this last week, made a lot of media noise about this, him being there. Like, these are individuals who have long-term concussions. These are individuals who had disruptions of their brain networks that were ultimately kind of, rehabilitated with psychedelics. So what are the other brain network disorders? Headaches. Headaches are brain network disorders. So it looks like headaches are being amenable again to psychedelics. We've got some emerging literature with cluster headache, with migraine. A lot of work with migraine is coming out of Yale right now using psilocybin. There's already been a small trial that showed promise in, I think, 10 patients in response to psilocybin. So we've got network disorders, traumatic brain injury, headaches, functional neurological disorders, right? So those three are real up front. Other ones that are trying to be explored now are like autism and dementia. Those are also disruptions of brain networks. A little bit more out of my area working with psychedelics in these situations, but that's where some emerging work is being done. And then the last thing I'll say is there's another cool area that's being explored in psychedelics and neurology, and this is through Golda Len's lab at Johns Hopkins. And what she's looking at are what are called critical periods. And critical periods are periods of development in the brain. So as an example, language learning. Language learning is a critical period. There's a period from about 1 year of age, about 5 years of age, maybe a little bit earlier than that, but there's this real defined critical period that peaks at like 3 years-ish, where language, your brain just has this unbelievable capacity to learn language. This is also, I'll take a sideways step here. I'm getting excited about this stuff. This is also why being a pediatric neurologist is the coolest thing to be in psychedelic medicine, because as a pediatric neurologist, we have such a good lens on brain development. And if you understand brain development, you understand psychedelics in a very unique way, right? So this to me totally makes sense. We've got this period where language develops. And if you've ever worked with children around this age and you've seen healthy, normal children, and you've seen children with language difficulties, children with brain abnormalities in this period, language is so interesting how it develops differentially in these brains, in these kids. So, we know there's this peak period. You can teach a kid 3 languages, and if you're consistent, that child will speak 3 languages. You and I try to speak 3 languages. It's not right now and learn them. It takes a lot of work. Our critical period for language is not as robust. It's not as flexible. It's not as open. So it looks like psychedelics actually work to open these critical periods. So this is where it becomes really fascinating. Can we, with psychedelics, as we start to understand and explore the different psychedelics and the different mechanisms and the different critical periods they have the potential to open, can we use this for rehabilitation? So what I conceive is something like a patient who has a stroke. And the stroke is where the brain cells get destroyed in a certain area. Now, the brain will respond and start to open its own critical period naturally, endogenously, in order to recover the lost function. But because the cells are not there, you get some degree of recovery. You don't get, which can be fairly incomplete depending on the size of the stroke and where it is. But with good rehab, and we know this, we can restore function to some degree in people who have had quite significant strokes. If we could extend that period, could we then come in with something like psychedelic assisted stroke rehabilitation, psychedelic assisted stroke physiotherapy, psychedelic assisted stroke occupational therapy? Could we intervene with a therapist at that time, utilizing the psychedelic to expand the critical period? And then could we even use the psychedelic for therapy sessions in that case? I mean, the potential is huge, and that's really, really promising for me as a neurologist, because we see people that are devastated by brain injuries, whether it be by stroke or infections, autoimmune disorders, all sorts of conditions that really destroy the cells in our brain and they don't regenerate or work well. Can we use psychedelics to expand these critical periods and to promote rehabilitation at those times? So two big areas to think about with psychedelics and neurology is the brain network medicine itself and the critical period extensions in terms of rehabilitation. Okay, I think I'll stop there.
Amazing, amazing. Thank you so much, Evan. That's so clear. And there's so much that you touched upon. And of course, just to answer some of the individuals who are wondering if this post is going to be on our website. Yes, it will be on Mighty Networks for individuals who are members of the pack, and it will also be released on YouTube. So no worries. I know this is a lot of incredible information that people probably want to come back to. So stay tuned as we share that. Again, you touched upon so many different parts. One part is, yes, that, a lot of this work is theoretical. And we talked about this last night when you and I connected. It's theoretical, then you have the mechanism papers, and then, moving into the fMRI imaging. And so this is going to be a long run. And it's incredible that even the mechanism papers are coming out, and you're working on one of those with your colleagues. And another really important piece is that, psychedelics are no longer, obviously we know psychedelics at their core are about unity, wholeness within ourselves, wholeness with each other, wholeness within the brain, wholeness within within nature. And so it only makes sense that these different areas of healing would come together. So you're stating with Dr. Curtis's research too, that it's not separate. There's psychotherapy that is helpful for some of these issues that you're talking about, but why not bring the worlds together? And I think the major trinity right now, especially as I work with my clients, and I, not only support them in the ceremonies, but pre and post, so much of it has to be within the realms of yoga, so anatomy and kinesthetics, and the nervous system. And then there's the area of meditation and mindfulness. So really, again, working with the brain and helping this regeneration and the critical areas and neuroplasticity in our own way. And then there's the area of medicine. And so, somatics, trauma, and medicine, they need to come together. And then, all the other slew of areas. So it's very exciting. That really deeply resonates with me too, where it's physiotherapy, and psychedelics. Now we have psychotherapy and psychedelics, but it can go into many, many different realms. And to that
point, tell me, like, it's really, I think you've actually touched on one of the most important points about this for the medicine world to really understand, right? It's the people in medicine have to realize, like, we've been boxed into our specialties, right, by tradition and education for good purpose. Like we needed to get ourselves all boxed up and really get good in our area. But now we're understanding, like, well, where do you draw the line? Like I love, like, it's almost, to me at this point, I don't know the right word, ironic or funny or silly, that you even have to articulate that that there's this mind and there's medicine, there's all these separate things, right? Because it's like, well, where is the line between, the neurology and psychology? Like, where is that line? There is no line. So and I think what's so neat about psychedelics, and I often have this conversation with our group in the clinic, is I really do think psychedelics will be a bridge. It will act as the bridge that will really bring this idea of the mind-body connection into our collective consciousness. I think we went through a period of time where it all got separated out for okay and good reason. We had to explore the extremes, and now we're realizing, oh, wait a minute, these things are actually connected the more we understand the extremes. And I think collectively, as especially in Western culture, there's going to be a big shift, and I think psychedelics are going to bring that shift about it. We're going to have some real interesting innovations in medicine in the next few decades because of this and because of psychedelics.
Absolutely, absolutely. And I, appreciate you bringing that forward with your clinic and, inspiring other doctors to step out of their boxes that, different kinds of traditions, as well as different kinds of specialization have been. And this is the time that, we need to see everything in front of us and on the table. And we haven't even touched upon, I want to go to the questions in a little bit, but we haven't even talked about, quantum physics and science and how, really the brain is working, not even in a linear way of, the electric impulses, but that there's exponential jumps and, how the brain is even communicating with different parts of itself. So that's for another conversation, another area that, both of us are very passionate about. So I'm going to actually shift gears, if it's okay, because there's so many great questions coming in, and maybe just share and get your
Yeah, let's do it.
Okay, awesome. Get your guidance on it. So interesting. So Luca is asking if someone with epilepsy and active seizures can sit in ceremony, and maybe anecdotally your experience of different medicines, whether it's peyote, cambo, bufo, ketamine, and how can someone begin, and then this is the second question, how can someone begin to get off their meds while also using cannabis to assist? So maybe that's a bigger question, but how do you feel about the first one?
Yeah, okay. So I think what everyone has to be real cautious about is the use of psychedelics in the context of epilepsy. So it's a real big question mark. We don't know. Now, if you go back into the literature, you might see that psychedelics kind of, promote epilepsy. You might see that in the older literature, but we got to be careful about what the older literature shows. And we have to really read that with an open mind to understand the socio-political culture at the time, right? So I think it's important signal, if you go back and look at some literature there, but there's also literature that shows that it doesn't have effects in epilepsy. So I think what needs to do is that specifically needs to be updated and modernized. And this is a whole area for neurologists to enter into, is to just, ask the question, does this? We're actually asking that question. So there's a student of mine who is working in a lab in Toronto right now. And so the research that we're doing is to see if psychedelics exacerbate epileptic tissue. So you can actually make like tissue that becomes epileptic, i.e. becomes electrically dysregulated, and we can add psychedelic components to them, be it some of the ones that were listed there, or psilocybin, or LSD, ketamine, etc. And you can see if it makes the epileptic activity worse in the tissue. If it makes it worse, we have concerns. If it doesn't make it worse, well, that kind of like tells us, well, look, maybe there isn't a promotion of epileptic activity in the context of psychedelics. But I do think if you are somebody who has epilepsy, who has active seizures, you have to be very careful. And I would speak with your neurologist. And if your neurologist doesn't have knowledge in psychedelics, you can come find me. I'm happy to talk to you about it, but it would be hard pressed to know who to refer you to at that case. But I would caution somebody significantly, especially if you're going to be somewhere where there isn't proper medical attention if you were to have an epileptic seizure. So, I know there are good retreats, good places but there are places that are very isolated. And if you were to have epileptic seizure there, it could be very dangerous. So I caution everybody against that right now. It's a big question mark and we don't know. The second question, how can someone begin to get off their meds while also using cannabis to assist? We do this often. So I've treated over 500 plus adults and kids, maybe more, with medical cannabis for epilepsy. And especially in those that work, we shift. So let me say this. When it comes to epilepsy and it comes to cannabis for epilepsy, cannabis is an anti-epileptic medication. Hard stop. I don't look at it any different. I don't treat it any differently. All the principles that apply to epilepsy medication in someone with epilepsy, I utilize with cannabis. So I would not approach that any differently than I would if we were, if you were not responding to medication A and I had to put medication B on. It would be the exact same way. So with cannabis, it would be the exact same.
Fascinating that. And correct me if I'm wrong, but you said that there's actual research being done where you look at tissue culture that's epileptic and you can add psychedelics and observe. Did I?
Yeah. So there's a few ways to do this, and I might bumble this because I'm not a neuroscientist or someone who works in the lab. So I would leave this to Brendan, who's going to be working on this in Toronto at Peter Carlin's lab. So you can take what are called cerebral organoids. You can actually grow tissue that is representative of brain tissue. And then you can splash chemicals on it that makes it epileptic. Meaning it makes the electrical activity of these cells dysregulated. And when you test them with electrodes, you can see on a readout on the EEG that it's having epileptic type activity. And then you can, at that point, you just add whatever chemicals you want to the tissue, to the cerebral organoid, and you watch the readouts. And if the readouts get worse, then you know you've done something to perturb the electrical activity and made it worse. So arguably, if we translated that up to humans, you would make it worse. So that's one way to look at it. And yeah, you can do it. It's quite fascinating. Another way to do that is people who have epilepsy, who have surgery, and they remove the brain tissue from the people that is epileptic. You can also do studies on that. You can take that brain tissue that is known to be epileptic, and you can do some basic science studies on that. So this is what Brendan's been working on. It's really exciting because that will inform a lot. This particular question here, which is a magnificent question. It's important because this is where it comes from my point of view. Neurological disorders are very challenging to live with. I mean, I don't have one, and many people I know do, and people have seen, but I can't imagine what it's like to walk into a doctor's office and be told that you have this neurological disorder. The amount of trauma and difficulty that must come with, and then having to then deal with it. And a lot of neurological disorders are chronic and lifelong, and to live with that, must be extremely challenging. So people with neurological disorders, there's an overrepresentation actually of mental health issues in this population. So this is a cohort of individuals who could benefit from the mental health healing properties of psychedelics, but we have to make sure they're safe. So can people with multiple sclerosis use psychedelics safely? Can people with epilepsy use psychedelics safely? Can people with spinal cord injury, as we mentioned before, use, right? So these are really important questions, and we need neurologists to help answer these questions.
Yeah, exactly. And, my heart just went to all those individuals who are, and, taking a moment to, to send love and to understanding for people who have come in with those issues that they're working through. And, with cannabis, because I organized a cannabis conference in Vancouver, 2 years of it being at the university, and just the amount of research and clinical practice and patient stories that came up around, headaches, epileptic seizures for children. Like, it's heartbreaking because these children are so innocent. And so back to this piece around cannabis, also, there's definitely more studies in cannabinoids and breaking down. So this is a segue into the second question. As we talked about, there's so many, there's definitely more understanding of which cannabinoids and the amount and the combinations that support, for example, epilepsy. But then we have a wonderful friend from actually South Korea asking if, for example, in the case of stroke or hemorrhage, which psychedelics would bring the most therapeutic effect and why? And would classical psychedelics and cannabis show similar effects on treating the functional seizures? And so this is why I brought up cannabis, because there's so much more understanding about the combinations. And then, but while, with psilocybin, we might not have, or the amount of ketamine, even dose alone, we don't have the understanding. So how do you work with your patients in that regard, especially when they have those questions?
Yes, so for sure. So, I mean, a lot of them, as I say, I don't know, and I'm very forthcoming We don't know. So to answer that question about stroke, we don't know. So this is emerging. There's actually, only a handful of papers right now that have talked about psychedelics in the context of stroke. And so I urge you to look at Goldolen's research. She even said, and she said last week, that this is an area they really want to pursue and look at. So I don't know. I don't know which psychedelics will bring the most therapeutic effects. I think this is going to be questions that will be asked. And I think we don't even know exactly what the therapeutic effects will be right now. Again, theoretical, and this is going to all have to take place in mouse models and rodent models and et cetera, prior to this even kind of being considered in patients for now. So I think there's going to be a bit of time before we have those answers. In terms of the question here, classical psychedelics and cannabis show similar effects on treating functional seizures. Again, that was the real important distinction I made at the very beginning, right? Cannabis works to fine-tune the electrical activity in the brain. Cannabis does that. Psychedelics, so far, it doesn't look like they do that. So for epileptic or electrical seizures, cannabis is a treatment. For functional seizures, cannabis is not a treatment that I can see directly. More so, this is where we want psychedelics because that's more of a brain network problem. Now, can cannabis treat functional seizures? Well, we know functional seizures often co-occur with PTSD, chronic developmental trauma, depression, other psychological issues. So could you use cannabis to address those things and then indirectly treat seizures? Could you use cannabis to help a therapeutic process that could indirectly treat seizures? Yes, you could. I was actually originally kind of using this previously in some of these patients. It's challenging. I haven't got the robust kind of responses that I'm seeing with psychedelics in the context of functional seizures. So maybe indirectly to answer that question, but not to the same, but totally different from epileptic seizures is what's really important to understand.
Great. Yeah, absolutely. Because, as you mentioned, psychedelics are definitely working, you're seeing it work more towards functional seizures, cannabis. And then let's bring it back to cannabis for a second. What cannabinoids, maybe if you want to go into the strains, have you seen support that?
Yeah. All right. So this is also a huge area to discuss. Okay. The challenge with cannabis and epilepsy and cannabis in general is that it is so complicated. There are 135 plus 136, maybe more cannabinoids, never mind the non-cannabinoids, all the terpenes and flavonoids. For everybody out there, cannabinoids act on this system called the endocannabinoid system, which is a fine-tuning regulatory system. It regulates fine-tuned processes in our brain, with pain, with mood, with the gut, with the immune system, etc. Non-cannabinoids are in the cannabis plant, but they don't act on this system. But they have some properties that may promote the cannabinoids. Big question mark there. Huge area of discovery to be discovered. Okay, so given that cannabis has emerged into the population, into the sphere, and especially in Canada is widely available, we don't have any really good experiments that will tell me and inform me for which epilepsy, for instance, which cannabinoids and which ratio and which proportion do I have to give this person with this type of epilepsy. And there are thousands of reasons why someone can have epilepsy. You have the number of permutations is unimaginable. We're going to ultimately to figure this whole thing out is going to be a machine learning process in the end, way beyond anything I can conceive of. And I think way beyond anything that anybody currently today can really conceive of ultimately. So what we have to understand is what I have available is knowledge of the two main cannabinoids, CBD and THC. Right now, that's what I have. That's what I have accessible to me as well. If I want to go off and start using CBDA, where am I going to get it from? Right? If I want to use a combination of CBDA, THCV, and cannabinol, where am I going to get it from? So I'm limited by what's available. So I can only work with what's available. So what I've done in my practice and the protocols we've developed are based on really what's available. Super limited, but that's what we got to work with. So in that sense, what I do is I look at the literature and I synthesize the literature. with my understanding of the endocannabinoid system, with our experience to date, which, as I mentioned, is well over 500 patients just with epilepsy, never mind, probably it's well over 1,000 plus patients for neurological disorders. And we've built these protocols that are safest for patients. So the way that we do this, Salimeh, for instance, for epilepsies, we start with CBD alone, and we just, because that's one molecule, it's easy. So if I give that to somebody who's having frequent epileptic seizures and the seizures reduce, well, I know that CBD alone is enough to fine tune that system to help with their epilepsy. So we try that. If it doesn't work, we then layer on THC. So now I'm only working with 2 molecules, but at that point, the oils that I'm using have different amounts of the other cannabinoids. So at that point, I'm thinking it's the CBD and THC, but I know the other cannabinoids are in there, and it becomes super complicated. So we try to start with CBD, layer on THC, and we try to get an effect for patients. And that's one way to approach this. It's the only way possible that I can approach this right now in the current climate. But I know all the other cannabinoids are important and are playing a role. And that's why I know I'm getting differential outcomes in my population. Some patients respond beautifully. 5 to 8% of patients with really complicated epilepsy, meaning they've tried multiple medications, treatment-resistant epilepsy, 5 to 8% become seizure-free. That's amazing. That number could be bigger if we had a better understanding of the endocannabinoid system and of cannabinoids in epilepsy, as an example. And the same goes for headache, the same goes for anxiety, same goes for behavioral issues with autism, same goes for pain. It's the same. To that, I'm hoping that answered your question, because that's another complicated one.
Yes, absolutely. And it's, the plant synergy and what cannabinoids and what terpenes are actually interacting. It's a whole gamut in itself. And I appreciate you just working through the isolation, CBD first, and then adding the THC, the different strains, and just the breakdown of the different cannabinoids as well. So it's amazing, and to see the results too. But you touched upon another piece of the chicken and the egg. Is it the software issue? Is it the mental health issues that are, being a cause of it? Where do you, what do you look at first? And in the field of the therapy. So I'll bring it into the next question that from Clive. And Clive says, if psychedelics reprogram the networks, what prevents them from programming undesired networks or other issues?
Well,
Great question.
Thank you so much. I know I'm going to echo you there, Salimeh. Thank you so much for asking that, because you're absolutely right. That and I literally had this conversation twice today with individuals who are interested in psychedelic therapy. This is why I am a big advocate of psychedelics being used with the right people, with the right practitioners, people understand this, with the right setting, because that is the biggest risk to me. And I have seen the people who have been reprogrammed in an undesired way. It's a way to, I'm doing this with air quotes if you're not seeing me, everybody, but that's the most difficult, most complicated people that are coming, who have who went off on their own, either with, poorly guided or just decided to do it by themselves. And they consumed a significant amount of psychedelics and made themselves worse. This is what we have to be careful of, right? So if I'm going to run with the software analogy, let's say, or the brain network analogy, right? If you're able to kind of get into the system and reprogram your software, but you yourself don't know what you're doing, you absolutely could type in some code that's gonna really perturb the software into a bad direction. So what prevents that? That's a real big area of research. We're looking into this. It looks like from the research, and if you are a practitioner and you work with people, and Salimeh, you could echo me here if you agree with this, and I'd love to hear if you do and what your thoughts are. The best predictor of how somebody's going to do is how well prepared they are. And the preparation means having an understanding of what they're emerging into, what they're doing, what's going on. This is why I'm like talking metaphors a lot, to try to get people to really understand what it is you're engaging in. how open you are, how willing are you to engage in what comes up, what gets amplified within you from the psychedelics. Like, are you willing to talk about it? Are you willing to engage with somebody? Are you willing to be vulnerable and dig this stuff out such that it doesn't, go off and get reprogrammed into a bad direction? Do you have the right setting and environment around you to support you in the event that things don't, work out, or you get really anxious there? I mean, all of this preparation, the preparatory stuff, is so important. And then during the experience, do you have the right person to guide you if things do come up and are difficult? And those tend to be the biggest predictors of having a positive outcome. And then afterwards, you got to be really careful, because afterwards you might have a great preparation, a really good practitioner who's guided you through this and helped you. But then afterwards, your brain is still in a flexible state. You're still in a state that a more reprogramming could occur, right? So that's happening afterwards. You've got to have ongoing care, and that having good integration therapy or care afterwards is a predictor of your long-term positive outcomes. So any steps along that path, things can go in the wrong direction, and still, despite having even exceptional kind of preparation work during and integration after, there is a risk. That risk is there. Of kind of running with your metaphor here, Clive, of programming undesired networks. That risk is there. And look, this is why psychedelics are serious stuff. As much as all of us talk about this and talk about how great they are, nothing of such greatness comes without great consequences in some situations. And we have to be really concerned not concerned, but we have to have our eyes on that and be realistic about that. And this is why we need to engage specialists and people with different perspectives to come together, so we can produce frameworks and we can produce models that are most safe, most effective.
Yeah, such an important topic. And I feel, in my own experience, starting with ayahuasca and diving really deep 10 years ago, it was the floodgates, the sledgehammer, and everything within my psyche really got brought to the surface, which I feel was an exceptional gift. But at the time, and I've talked openly about this, it was, there was psychosis, there was a dissociation from reality at times, and it was very large doses at the time, and exploration with other kinds of medicine, LSD, San Pedro, and there was guidance within my own psyche to move forward. And I had an incredible mentor along the same lines. And before I even went into psychedelics, I had close to 30 therapy sessions of inner child work. And we know now IFS is making, a huge, it's an explosion within the therapy realm, internal family systems, if some of you know about it. It's an incredible modality that looks at the different parts of the human psyche and really acts as these exile parts that have been pushed down and repressed because of trauma. And so, I had all of that, and still issues came up. And so now, I come from the angle that everything is actually here to support us. So even if a reprogramming that goes into negative space happens, I still feel like, even when I work with my clients, of what is this here to show you? Everything here is to help you. And so if we come from that positive perspective, there's a sense of agency and sovereignty of what the person is working towards. And it can be difficult, things can come up. So, I feel now, if I could go back to, 10 years ago and working with the Salimeh that, was going through the processing at that time, I, just like how I do with my clients, I titrate it, and we go so slow. And we go so gently into family of origin work and the trauma work of childhood, and really give the spaciousness for breath and anchoring in the nervous system before even coming into, ayahuasca or ibogaine. So really working with the medicines gently and microdosing just to begin. And then trusting that everything is happening for a reason. And then we step into more of like the esoteric of karma and what we've chosen. If we go with the perspective that we chose to come into this life, and someone, even a beautiful young child who's chosen epilepsy, it's hard to say, like, why would a child choose that? Or why would someone choose to have really bad a neurological issue or MS? But at least this is just my perspective. It's like, if we've chosen to come to this life with that lesson and those lessons, what is it there? And how can we create less suffering in that person's existence? And that person has to be ready. But ultimately, you're absolutely right. It's totally uncertain territory and things can happen. And I feel that, there's more and more mindfulness now. As the explosion of psychedelics has happened, it's like, now, okay, how do we bring it into even more refinement, more embodiment, and sensitivity to what's actually coming up?
Yeah, and as you're saying this, there's simple things here. It's it's just almost like, our especially Western culture, we're not trained well to understand the mind as a thing. So it's almost like, in what you're saying, it's like, if we understand the body so well, though, right? So if you were going to train for a marathon, right, you wouldn't just go out and start running and still eat pizza and lie on the couch at night. You're gonna probably read first, and you're gonna read about nutrition. Like, you're taking it seriously, right? Like, you're taking it seriously. You want to do that marathon. First off, you're not going to do it tomorrow, right? You're going to plan, I'm going to do it in 6 months, and you're going to start reading about nutrition, maybe sleep habits, vitamins, right? And then you're going to start doing stuff for your body and taking care of your body, and slowly, maybe you're going to start walking long distances first. You're going to buy good shoes, right? Like, you're going to do all this stuff to run this, and that is such a obvious thing to do. But if you want to shift your mind, if you want to shift out of this state, like, it's not something that you can just do the next day. You've got to prepare properly for it. So knowing that these medicines are really going to take you on that marathon, it's almost like you got to start getting ready for it. And it's a multimodal, multiple different techniques, multiple different coaches, and you want to synthesize all that information so you're ready for marathon day.
Absolutely. What a great analogy. And yes, preparation in a whole different level. And so I love that you brought that up, because with my clients, absolutely, we got to get the blood test. I want to see what's even going on in their body. Okay, do you have your naturopath, as you're stating? Do you have your acupuncturist? What's pain like in your body? Let's maybe address that first, and to bring you into a place of at least a little bit of equilibrium before you step into, and then alongside with microdosing, and then moving gently through massage and physio, and then coming exactly to the marathon, which is, one of the plant medicines, and a deeper dive. Really well put.
They might be ultra marathons for some of those medicines. So
exactly. But it's a dedication.
Marathons, yeah.
Yes, exactly. It's a dedication, and if we're committed to, the clarity and coming into, I keep going to the word of equanimity and equilibrium. If you really are committed, the plants are here and the psychedelics are here, and there's absolutely ways. There's so much hope. I've seen it. And, this is a shout out to my dear colleague, Trevor. Trevor is a wonderful advisor to PAC, and he's one of the founding members. And now he has Ambio, and they work with vets specifically who have every issue that you talked about, from issues with sleep, interpersonal relationships, alcohol addiction, tobacco addiction, post-traumatic stress, nightmares, all of that. And they come into Ibogaine, and plus all the other modalities in that 5-day retreat, plus 5-MeO, and the research that now, Dr. Nolan Williams has done, it shows actual shifts in the brain like physical changes in the brain. And so it's so exciting, but yes, they're preparing very well before they come in, and they have a action plan afterwards. But there's definitely some miracles that are taking place with psychedelics, and what a gift it is to live during this time that we have access to the medicines. We have around 10 more minutes left. You've been brilliant, Evan, and I know it's a lot to share and different directions that we've gone into.
This is awesome. This is awesome.
I really appreciate it. And we have another question from Kunain. I hope I'm pronouncing your name right. Kunain says that he's an investor in Numinous, and it's because he believes in the psychedelic use in treating mental health and addiction disorders. And he's actually bringing in a different kind of question and asking about tackling the stigma around psychedelics. We just had psychedelic science in Denver with around 12,000 individuals going and speaking and being together, and so many different tracks. So yes, what about for you, Evan, as you spearhead in Canada?
Yeah, I'm wondering if this question is about you, Numinous, or you, me. I'm going to answer it from you, me, because I think that's a little bit more interesting from my point of view. But it's very similar to cannabis. Again, I was working with cannabis in a challenging time as well, and I think cannabis was almost like it really prepared me to approach and face the stigma. Okay. I think one is having a proper perspective. And I think that perspective, and maybe psychedelics kind of helps one have this type of perspective, is complete compassion. There's no room for blaming. When you meet an individual who is, you might believe or feel that they are totally lost in their stigma and are doing everything to fight against you about your opinions about this or whatnot. Complete compassion. There's no room to engage in any kind of argument with them from my point of view. It's about holding space for that person and for yourself in that interaction, and recognizing that we all came from the history of the environment that was one where these medicines were completely stigmatized, and people are going to have perceptions about it that you are not going to change. I'm not going to change anybody's mind, and I'm not in the business of changing people's mind. I'm in the business of sharing my passion, sharing my interest, sharing my knowledge that I was gifted by those around me that trained me and that I was open to receive, and sharing that. And that's it. And not having any, I don't hold any weight or value on on how someone else changes their mind of what they believe in due to whatever it is I'm saying or doing. I will just do what is meaningful for me. And through that, perhaps by example, others might see something positive, and that might shift their own ideas about themselves and the world that they live in. You will not change anybody's thoughts, especially if they are immersed in stigma. It's an impossible task. And I really do have, and so to make this kind of very personal, talking about other physicians, right? People who in the face of evidence for cannabis for epilepsy, or be it psychedelics for maybe functional seizures, who are probably going to potentially fight against this or push back against this. Good, I hope so. They should push back against it, because they'll push back enough, and eventually my hope is they'll push through nothing and realize they're not pushing against anything, and maybe they need to open their eyes, and maybe that's the case. But I have a ton of compassion for the physicians who have no knowledge about psychedelics, because this is so unique for physicians and for healthcare practitioners, nurses, physicians, therapists, etc., who don't have the knowledge around psychedelics yet, or haven't explored or looked into it, or haven't been open to the idea, or it's really difficult when a person who you want to help as a physician, genuinely deep in your soul, and you've taken an oath to help that person, and they walk in and they know more about some medical intervention than you do. That's a very discomforting position for a physician to be in. We're not trained well to be in that position. It's improving, but we're not. And it's really, we have so much we need to know and learn about our specialty that that is really, really, really challenging. And I feel for the physicians in those places. And for me to go out and lambaste them for not knowing psychedelics, or to say you're immersed in stigma, you've got to wake up, all I'm going to do is push them further away. So all I can do is go out and teach, hold webinars, have conversations like we're having tonight, show how cool this is and fun and interesting, and maybe some people will gravitate towards it and others won't. And these things, we have to be patient. As much as we're excited about psychedelics and what's to come, this is a generational shift. It's come out of generations of stigma, cultural baggage, difficulties, and this is going to take a generational shift. And to the last point there, it's also important that we do this cautiously, that we don't rush into this, that we're doing this in an intelligent, smart, conscious way, such that we don't fall into the traps and the difficulty that emerged in the 50s and 60s, ultimately making these things unavailable for decades, and also being safe for everybody. We don't have all the answers. As much as psychedelics might be great and hold promise and potential, Salimeh, you and I are talking about situations, and to speak to the degree of how consequential these things can be, and we've got to be delicate with them as well. So longish answer, but I'm passionate about this because I think it's important for both sides to be appreciated, both the healthcare practitioners and the people who are suffering. And if you have a lens on both those, this is the fastest and most effective and way to do that, and it's through compassion.
Beautiful. Yeah, exactly. And I appreciate that so much in embodying the medicine and really, showing up, leading through example. If we want other people to be open, then we have to take the lessons of medicine and show up kind and, and just let things really be in that equanimity, and things will open up as they do. I have 3 more questions here. I apologize.
I'll be faster. I can just talk about this stuff forever.
No, it's awesome, and love your enthusiasm. We have a question from L Pink. Apologies that we didn't see it. It's a great question, and it says that there might be some correlation to autism and neurodivergent individuals, and she or he says that Aaron Orsini with Autistic Psychedelics is involved with various universities and with Beckley Foundation, and his book Autism on Acid was mentioned on Joe Rogan and Rolling Stones magazine this week. And this individual is asking what your thoughts are in the area of autism and psychedelics.
Yeah, I don't think so I'm going to kind of pass a bit on the question. I just honestly, so thank you for the question. I don't think I'm equipped enough. So there's a bit of difference. Canadians, neurologists, we don't get a lot of training with autism. We see autism kind of secondarily through a lot of neurological diagnoses, very different from the US. US neurologists have a bigger role in autism through the training. So we don't, so I personally, I worked with many autistic individuals through neurologic diagnoses that arise. So things like tuberous sclerosis complex and other kind of brain abnormalities. But that is mainly the work of either developmental pediatricians in Canada or psychiatrists, child psychiatrists. So I haven't really explored this. I don't think I'm qualified enough at a basis to really answer that. Great question. And I always love these things because it always opens up areas where I need to I need to look into that a little bit more. So thanks again for the question, but I really don't think I'm the person to answer that.
Awesome. Appreciate that. And great question, because we will bring it up hopefully in another webinar. And of course, yeah, you're very welcome. It's great for us to get feedback from our community to anchor in different kinds of subjects. So definitely we'll bring that back to the team of the board and our volunteers. Next question, what is the best diagnostic test to determine if it's functional or epilepsy? Is it a video EEG?
Yeah, so your video EEG, so video EEG is kind of your quote gold standard to some degree. Because if we're able, now the problem with video EEG is you have to, so for those that don't know, that's wearing the EEG and having a video as well at the same time. And then what we can do is we can see the episode, and then we can look on the EEG and correlate the appearance of the episode with the activity that's going on in the EEG. So that's the best way to rule in a seizure, an epileptic seizure. So if you're having an episode that looks like a seizure and we look on the EEG and that's very typical epileptic activity, that tells us it's an epileptic seizure. So we're able to tell you that that's an epileptic seizure. Now, if you have activity and I look on the EEG and it's normal, all that tells me is that likely this episode is not an epileptic seizure. EEG is still limited. So EEG goes on the outside of the brain. It can't measure things very deep in the brain. So one can, in some situations, have an epileptic seizure and the EEG can be either normal or it can also be unequivocal, meaning we can't really determine on the EEG. So very important to understand. A functional seizure and an epileptic seizure, the video EEG is a good guide, but it's not a be-all and end-all. These are clinical diagnoses. What does that mean? It means you have to take multiple different pieces in order to synthesize the whole picture. So the appearance of how it looks, history, a whole bunch of other things have to come in with the video EEG, even when we capture one. So this is why this is really complicated. And this is why specialists need to be involved in this if we're going to really pursue this, because just getting the diagnosis correct takes a lot of training and specialization and working with a lot of these patients. So I hope that made sense there. High level, it's complicated.
Yeah, definitely. Thank you so much, Evan. We have one more question, but because we're running out of time, Clive, thank you so much for putting your question around regulatory authorities and how, psychedelic approvals and actual delivery of therapy is going to work out. We're seeing examples of this, of course, in Colorado and Oregon, but it's a great question and a bigger conversation. But I just wanted to take the time, as we have last few minutes, to thank you so much, Evan, for coming and sharing your wisdom. This is years and years of your hard work and really showing up for the community, the patients, and also advancing the research, teaching, and there's a lot that you're giving right now. So we as the community really appreciate you, and thank you to the team at Numinous again for supporting the PAC's vision, and Peyton being a close ally. Just really love how the company has grown and what it stands for. And all the thank yous are coming in. And Evan, any last words?
Just thank you to everybody who showed up tonight. And as you may see, as we've mentioned, I love talking about this stuff. So, stay tuned. I'll have more webinars online and stuff like that as well. It's a real exciting place for neurologists to be, and and everyone else. So thanks everybody again. And Salimeh, thanks for having me, and thanks to the PAC for having me as well.
Absolutely. Our pleasure. Thank you so much, community. Again, feel free to connect with us at any point, to give us suggestions or feedback. We're always open. And also join us as a PAC member on Mighty Networks. It's an incredible community of around 1,000 individuals across Canada and more. Always social media is a great contact as well. Thank you again, everyone. Evan, have a wonderful rest of your evening. And thank you to our volunteers who made this happen.
As well.
Thank you.